good.
I started my teaching career in Greater Plains.
Oh, at Greater
actually, yeah.
Plains. Well, we're gonna wait 2 more minutes to see if we get a couple more jumping in, because we have a total of 7 signed up. Let's see, who else do we have here with us? We have Brianna, Brianne, Bree. We'll just go with Bree. What do you teach, Bree?
She's muted.
Sorry, I couldn't find the speaker button. So I teach special education at Gilboa Conesville Central School in the elementary.
Ah, Gilboa. That's where Amy, what's the last name? Amy
Oh, she's a
Wilson.
Spanish teacher. Yes.
Yes. So she was on our board. She just stepped down.
Nice. Nice. I have a therapy dog, so I'm very excited for this. Like my dog is a certified therapy dog. And I've
Oh,
yes,
wow.
yep. So I live in Cobuskill, and they have SUNY Cobuskill is the college there, and they have a canine management program where students go to school to work with canines and all that entails. And one of the classes they offer is a therapy dog class. So yeah.
Super.
At Cobuskill?
Yeah, at SUNY Cobuskill. So they need they take dogs from the community, and they're the students for the students who are learning how to work with dogs. It's an awesome program.
So then the dog gets certified but
Yeah.
lives still with the owner, but
Mhm.
uses them.
Yes.
That's fantastic. I think I might have to get my puppy in there.
Yeah. And it's
Wow.
awesome because it's like doggy daycare. So I have 2 dogs and they go to school 2 days a week.
That is awesome.
Interesting.
So
Right?
awesome.
Maybe you should be giving this program.
No, because I need help getting this program to my school.
To your school, right?
That's
That I
what
think I can help with.
that is what I need. I've been working on it for a year.
Schools are very resistant. They're well, it's the lawyers that once they get the lawyers involved, that's been the barrier.
Ah.
And I don't think the lawyers understand that the dogs are like they're insured. Once you're TDI certified, the dogs are insured, and the lawyers don't get that piece of it.
Absolutely. That's the tricky part. And like I carry extra insurance too,
Mhm.
which is very minimal. It's like $100 for the whole year. And it's just like an extra peace of mind.
All right, well, I think we should jump in and get started here.
Can I just jump in quick and ask Bree how she got involved with Cobuskill, like what the process was for that, or where you sign up, all that kind of stuff?
Yeah, I'm sorry. So I live in Cobuskill, and it's through SUNY Cobuskill. I just kind of searched around and I looked under the canine management program, because I believe that's what it's called, like canine management. And then there's a contact name and email, and I just was like, hey, can my dogs come? And they said sure.
Awesome, thank you.
Mm-hmm.
So we're gonna get started. I am Aaron. I have to change the name because I'm actually gonna turn it over to MJ here in a moment. But MJ is a policy board member here at the Catskill Regional Teacher Center, and I was just saying to her, this is exactly what we want to see. We are all about empowering teachers, getting teachers to kind of move from the classroom into professional development and supporting other teachers. And if you think about this kind of a topic, this is not something that most school districts are really going to be pounding down doors to do, but teachers are interested in that. And that's the heart and soul of teacher centers. What do teachers want? Right, so really excited to have MJ here. As we move forward next year, there's a couple of opportunities I want to throw out at you guys to keep your eyeballs out for. We pay teachers to do research in their classroom. So this might be a really kind of cool area to do research of what is the impact of a therapy dog in the classroom. We have 2 components of it. One component is just the research that you'll present to us in the board or whatever. But the second component, you would work with a college professor to get published in a trade magazine of some kind that you'd work that out with the professor. And then there was another one I wanted to highlight, but I can't remember at the moment. I turn it over to MJ. And thanks MJ for doing this.
Sure, no, thank you all for logging on, and thank you, actually, a huge thank you to Aaron, because I sent him what I made for the slideshow and he made it so much prettier. So we'll push that out to everybody when we're all done, so you have all the information. Can you hear me okay? Everybody's good. Okay, good, thank you. Do I just click this and
Yep.
it'll switch? Awesome. I'm new to this whole thing. I'm MJ. I am a special ed teacher. I'm currently at Walton. I will be moving actually next year to Cobleskill. Speaking of Cobleskill. So I think I might just bring my pup right over to the college on my way to school and let them work with her, get that done faster. She is currently in training. She's 8 months old and we're working on our good canine certificate first. That's where the process that we're in. So please, Bree, we met you. Thank you for that. If Jenna and Jordan want to introduce yourselves, tell us where you are and what you do. Either one, whoever wants to just jump in.
I can start. My name's Jordan Klein. I'm at Otselic Valley Central School, so probably one of the smaller
Yeah.
schools. I am acting as a student support advocate while I finish some of my social work certifications. But I do a lot of classroom push-in. I'm familiar with the whole environment, and I have a 14-week-old golden retriever right now that I'm investigating this process with. So
That is super fun.
I'm Jenna Farrell. I am a special ed teacher in Oneonta, and I have an almost 2-year-old mixed breed dog. I always thought about getting her trained as a therapy dog, and I have a little sister with Down syndrome, and she's very calm, and she kind of seems to read the room a little bit with how to act around different people. So I think that she might be a good candidate for a therapy dog.
Nice. Nice. All right, we'll jump right in. So I don't want to keep you guys any longer than we have to. Just basically, we're going to quick go over the physical, the benefits, the mental, emotional, the cognitive, social, all of the things, all the reasons. There is a ton of research that does show that the dogs, every dog, not just therapy dogs, do improve your cardiovascular health. It does. They use them in hospitals, as I'm sure you well know. They calm kids down. They use them in courtrooms. It lowers your blood pressure. It lowers anxiety and relieves pain. And there's just so many health benefits to having a dog. I'm sure other animals do that as well. I know cats are known for that, but dogs are more, people just kind of they're drawn to dogs more easily, I think. And cats you can't take out for walks. They're just not as agreeable to that because they're cats. They offer, I don't want to just read these slides. You guys can read them yourselves, but it is the unconditional love. They do, like I said, they decrease the anxiety, the stress, the symptoms of depression. They have, documented they release the endorphins, and I don't know whether it's just oh, I love these dogs and they're so happy to see me, or just the repetitive motion of petting them that releases the serotonin that helps lower levels and stuff. So it's all good things. They have definitely, oh, somebody rang and I don't know how to let them in. I don't know how to do that. And he left me. I'm sorry. I don't, there's nowhere to be like, let this person in. So I guess they're going to have to just hang out. Sorry. So the social benefits, you guys are probably a lot like me. Like you see a dog in the mall and you're like, oh my God, can I pet your puppy? Like that's totally me. If you asked me like, who did you just meet? I couldn't tell you who the individual was, but I could tell you what kind of dog they had, that's how I am. I know a lot of people who are like that as well. So it does initiate that conversation. I take my little girl to the mall, once a week we go, and people will stop. They'll just walk right up to you. Hey, can I pet your dog? And then conversation starts. So for people that are more shy, children especially, that it just draws them out. So it's all good stuff there. It does build their confidence. We see that a lot in the reading dogs, and we'll get to that later in the slides, but there's a lot of research that shows the reading to the dogs does bolster the confidence of the child too. And of course, the community, it's just, like I said, people are all like, oh my God, it's a dog. And people just gravitate towards them. And so you immediately have this thing in common, like, oh, we both like dogs. Okay, what else can we talk about, kind of thing. So there's definitely social benefits. The settings, like we said, we see them a lot in our hospital. I know Bassett uses them. We used to have Duncan. He would come. He's since passed away, which is super sad, but Duncan would come and you could just feel the energy change in the room when Duncan came. Like people would just relax and they just wanted to pet him, and he was super chill. He was also a golden. He was older but they're great. Their temperaments are really good for therapy dogs. Once they settle down, they usually have to be, a year or two, but they use them in crisis things. They use them in natural disasters, traumatic events. Like I said, in courtrooms when children have to testify. In doctor visits, they'll bring the dogs in so the kids aren't afraid. So there's a ton of different places that dogs can be brought into. The 4 main certifying organizations are Pet Partners, Therapy Dogs International. That's the huge one. Oh, there's the admit. Okay, there we go. Hi, welcome. Pet Partners, Therapy Dogs International. That's the big one around here. That's the one most people will be certified by. Alliance of Therapy Dogs, they also certified. They do things a little bit differently. And the Intermountain Therapy Dogs, they're the ones who established the reading program. So that's where that all came from. And I do have all the links in here as well. They're live links. So when you do get the slide deck, you can just click on them for more information. So they do undergo a fairly rigorous training. TDI, Therapy Dogs International, they won't certify a dog until it's a year old. If you get a dog like from a shelter and it's over a year old, they'll want you to have it for 6 months to a year, I think, depending on the breed, because they want to make sure that you have a good bond with the dog also before you start bringing it into places. Because if it's a shelter dog, you don't know its background and history. So there's that little caveat there. They typically, the handlers, they're kind of trained as well, but it's a team thing. So when you're, obviously teaching your dog to sit and stay and come and all the things, you're learning it as well, like what triggers your dog and, what hand signals work and, that kind of thing. So the steps to certification, this is the part where this will help you out in your school, right? So this is the part where I was like, nobody's ever had this all written down in one place. I just kind of learned it piece by piece sort of thing. So they have to obviously be a good temperament, right? And you're going to know if your dog's a good temperament. They're not going to be too jumpy. So like they don't get scared at every little noise, or they don't run and hide behind you. It's okay to be a little like skeptical when meeting new people, but as long as they're not barking or jumping or obviously biting, right, that's not going to work. And it's not fair to the dog, because if they're that nervous about new people, then why would you put them in that situation like on a daily? So they definitely have to have the most, a good temperament. They can ignore other things if they're paying attention to you or paying attention to whomever they're working with. Basic obedience classes, TDI doesn't, they don't require it, so to speak, but they expect it at the same time, because if you're going to go through the test, your dog's going to have the basic things down: the comes, the sits, the stays, the recall. Those are the big ones. So definitely go through the class with your pup. There are a bunch of really good trainers right in this area, in the Otsego, Delaware County area. I've trained personally with Pondside Labradors, Diane D. Dominicus. She's amazing. I can get you a number if you want. And I know there's a couple others around here as well. Diane's got all kinds of ribbons and awards. She does agility. She does basic obedience. She does advanced obedience. She does scent work. Like, she does everything. She's amazing. So the first thing you're going to want is your dog's going to pass the Canine Good Citizen test, which basically is like, does it bark at other dogs? Can you walk past other dogs with it, not being aggressive towards the other dog? Like my little girl, Zena, she's a baby. She loves everybody. She's fine. But my border collie, she's 3 now. And if you walk up to someone, her and I walk to someone, she's fine. But if somebody walks to us, she goes right into protect mode and starts barking and growling. And it could literally be the same person that just pet her 3 seconds ago. So she will never make a good therapy dog. She just won't. She's an agility girl. but Xena is different. So the Canine Good Citizen test, then the TDI test, it's more extensive, and I'll go through all that too, so you'll know what to expect. And at this point, once you have the TDI certification, TDI certifies, like insures your dog. But here's the tricky thing. If you're at school and you're getting paid, like, because you're working, then it doesn't. So there's a weird kind of loophole they have there. So like Bree, you said you carry the extra insurance, and that's probably why. So that's a good thing you have that. So that was definitely something I learned on this journey I've been taking. The next step would be, I kind of jumped steps because I went to the board first and I was like, hey, this is what I want to do. Here's a presentation. And I had all the data and all the research supporting it. And the board was fine with it. We actually have a policy for dogs at our school, but then our principal, who is new, and is very by the book because he's new, and no disrespect meant, but the lawyers were like, no. And I'm like, but we already have a policy. And he said, well, your dog, yours is a puppy, it's not a dog. And I was like, do you hear what you're saying? Like, it's the same thing, but okay, whatever. And so our puppy could go to our ag room, and that was fine, but she couldn't come to my classroom because she wasn't a dog, she was a puppy. So like, that was just like, whatever. So she's coming with me to Colville when I move schools. So I do have a presentation actually all put together with all the research and stuff, which I can also share with you if you're interested, and you would just like change the names, you know, that kind of thing. You would check with your school nurse, make sure there's no pet allergies. I do have one kid in my room presently. He is allergic to dogs, but it's not like it's not a deadly allergy. It's like, if I touch a dog, I have to wash my hands kind of thing. And these are high school kids I work with, so they know what to do. So it wasn't really a threat to him, but definitely check with the school nurse for allergies first. Send home notices once you are board approved. Before you start, you send home notices to all the parents that might be impacted by it. We have a therapy dog coming. Here's an opt-out form if you don't want your child near this dog. And then you just kind of work out the logistics, like, okay, well, if little Johnny shouldn't be near the dog, then we just won't bring Johnny in. You know, we won't bring the dog in the days that Johnny has resource in my room, kind of thing. It's a little tricky, but it's manageable. So that's the biggest part of it. The Canine Good Citizen test, this is the easiest one for them to pass. I don't know if you can see the pup behind. That's Xena. She's my little girl. So they have to be able to greet a friendly stranger, which means like you have her on leash, somebody will walk up to you, you'll pretend to have a conversation, and then they'll, you know, and they'll keep moving on. So it's a couple of seconds, like just an interaction. And ideally the dog will just sit quiet or stand quiet and just wait and not try to jump on the person or not bark at the person. When they do come to you, you can have them just like put your dog in a sit and let the person sit, you know, pat the dog. They're going to look like when you do the actual test, because a lot of this stuff you can just do like in the mall and stuff like that, right, with regular people. But for the actual test, you're going to have them, they're going to sit politely. They're going to, the tester is going to check, they're going to touch their ears, they're going to touch their feet, they're going to lift their tail. So things that the average person petting your dog isn't going to do, but your dog still has to be able to like tolerate all of that kind of attention. They'll brush them, walking on a loose leash, so they're not pulling you, that kind of thing. This little one, she's still working on the loose leash because she's like, she just wants to, she's a chaser. She's the Aussie healer mix. So she likes to chase things. So she's working on that. They will have you move politely through a crowd. So there'll be like 3 or 4 people just standing around doing whatever. And you have to just kind of navigate them without her paying much attention to them and just sort of focusing on you. The sits, the lie down, the stays in place on command can be voice command or hand signals. Either one works, or a combination of both. Come when called. This is a big one because they're gonna, you know, my little girl is like nose down, ears off. She all of a sudden doesn't recognize your voice. You know, she's like, oh, but there's a rabbit. I can't pay attention to you. So we're working on that. She, behaving politely around other dogs. Like I said, my border collie, never going to happen with her. She just does not like other dogs. I mean, she likes our dogs in our house, but other dogs, not having it. The little one that's learning, she's great with other dogs. She doesn't care. That doesn't get scared, they're reacting to the distractions. So I took her up to one of the coaches for our trap team. So I brought her up to the range where they're literally shooting shotguns. And she was great. She totally ignored it, didn't care about the noise, didn't care about all the people, like that kind of thing. So they have to be able to react to those distractions. Like if you're in a hospital and somebody drops a loud tray, they can't like get all scared and, start barking and whatnot. And the last one was can be left with a trusted person. So what they do in the test is like you hand somebody, the leash, the person giving the test, like here's the leash, or you have a helper with you, here's the leash, and you walk away from the dog, and the dog ideally will stay with that person. Xena, my little one, she does that no problem. My border collie will literally dig her heels in and will not go with anybody else. She's just that girl. So she, like I said, she will never be a therapy dog. It's not going to work for her, but the little one. So TDI, they have to be at least a year old to be tested. The dogs, of course, have to be healthy, have all their shots. The handler, they're going to check, not so much a background check, but they're going to make sure you're not some kind of, bad person, like using your dog to get into places where children are or hospitals. Like, I don't remember ever learning or hearing about any of that ever actually happening, but I feel like that's an avenue that if they figured out they could do it, they might do it. I don't know. So for TDI, the minimum age for the handlers is 12 years old without help, but when they're on visits, they have to have a legal or parent or legal guardian with them. So from 12 to 18, they still have to have a parent or guardian on the visits. Here's another thing I did learn about TDI. If you're registered with TDI, you cannot be registered with any other organization. So like, I forget the other one off the top of my head. Oh, the Alliance for Therapy Dogs. So they do a different kind of evaluation, and then they recommend you get passed by TDI, but you have to belong to their organization to do that. So that already precludes you from joining TDI because you're in their organization. So that was another kind of loophole that I discovered on this journey. So TDI, you cannot be registered with anybody else. It's just them. They don't register service dogs, TDI. None of these do. Service dogs are recognized by the ADA, and they are trained specifically for one purpose. So if it's like a seeing eye dog, or it's cancer detection, or a seizure detecting dog, like they literally have training for one purpose. Those are recognized under the ADA, and those dogs, service dogs, are allowed everywhere. The oh, sorry. So these dogs, therapy dogs, they can be allowed, but they are not legally required to be allowed. So that's the difference. And there are a lot of people who just go online and buy, like, oh, I'm going to Amazon and I'm going to buy a service dog vest and think that that works. And it doesn't. And then they get mad. Well, what, my dog's a therapy dog, I have a vest. Well, anybody can buy a vest, but you need to actually have the training certificate. So there's that piece of it. So there is a difference between actual service dogs and therapy dogs. More and more therapy dogs are being allowed into restaurants and on airplanes. And some hotels, most hotels actually will even take them at this point, but they don't have to. So that's where you have to just know the difference there. So when you do get to the evaluation, it begins like as soon as they see you. It's not like, okay, sit over there and it's your turn, then we'll do the things. Like they're watching you right from jump. So the minute they walk in the door, they're watching you interact with your dog interact with the environment. And then they go through the whole formal testing. So just to be aware that it does start like just right from the beginning. Like I said, formal obedience classes aren't required, but they are recommended because that does give you all the chance to learn the sits, the stays, the comes, and get them in the various environments. Before I go on, I know I'm going really fast because I don't want to keep you, but I want you to have the information. Are there any questions yet so far? Are we good? We're good. Can I move this?
Oh, yeah.
Can I shrink that?
Yep.
Okay, there. Okay. They're just like shaking heads.
A trick when you take the test is do not let your dog take a treat from an evaluator. That's an
Mhm.
instant fail. So
Yes, yeah,
remember
that
that
is,
that's a huge test part.
yes, yep. Thank you. Okay, so these are the actual tests that TDI gives according to their pamphlets. So like we said, you're going to be checked in, you're checking into the hospital, so to speak. You're going to come up, they're going to check their ears, their nails, lifting their tails, lifting their paws, all of those things, which your dog may or may not be comfortable with. So you're going to want to make sure your dog is comfortable with being handled, like being touched, physically touched by all of that. They're very specific about what kind of collar or harness to wear. And everything's on a 6-foot leash. They do also do a recall, which is a 12-foot leash, but for most of it, you're doing the 6-foot leash. So here's the check-in. Here's where you're like, sit, stay, and you sort of disappear for a minute to see if okay, there we go.
Sorry, I thought I was being helpful and
Being helpful.
trying to shrink it down so you could see your screen better, but then somehow I muted it.
That's all right. So we're up to, I have it on here too, so I was like, okay.
Oh, all right.
Yeah, no,
sorry.
we're good, we're good. I just want to make sure I give you all the like things, all those things I've learned. Okay. Proposals, a copy of that, what we've been doing, the minimum age. Okay, the service dogs, we talked about that. So the steps, so we were talking about step 2, the checking in, the out of sight. So the helper is going to take your dog, you're going to walk away from your dog and they're going to just keep your dog for like like a minute kind of thing, and make sure the dog handles that well. And sorry, my notes are all messed up now. Again, it's a verbal command or a hand signal. My girl's learning both, because sometimes if they're far enough away and there's noise going on, the hand signals do tend to work better. She's also triggered by, like, she knows where I keep the treats. They're always in a pocket. So if she sees me reach in my pocket, she thinks she's getting a treat whether she is or not. So there's that. So you have to be aware of your body language with your dogs, because they are watching every little bit. The group sit stay, so they line up all the dogs with 8 feet between them. They typically like to do multiple dogs at a time for 2 reasons. It gives them that experience with other dogs in the area, so you can see how they react, and also to save time for the handlers, the testers. In our area, it's good to know that Cobleskill has that, because prior to knowing that, so thank you for that, Bree, there was like a long wait to get a handler to come. They were coming like from Rochester, and they just didn't want to come to our area. They're like, it's too far, not worth the drive. There's only 3 of you, kind of thing. So it's good to know Cobleskill doing that. Test 5, same thing, down, stay. My little girl's, she's little, she's young, so she doesn't like to stay still very long. So she's working on that. But that's stuff you have the time to do before you take the test. That's why also too, you have that year of growth before you take them in for their test. The recall, like we talked about, the 20-foot leash. So what they'll do is, like, your dog's on your 6-foot leash, they'll click a 20-foot one also to it. So it's on both at the same time for a minute. You will set your dog in a sit stay or a down stay, and then you'll turn around. So you're not facing it, turn around, walk away to the end of the 20 feet, and then recall the dog. So it's not going to go anywhere if it doesn't come back. It's safe, it's on a leash, but it has to be able to come, and you have that space between you. The visiting with the patients, so they simulate that. They have people in wheelchairs, they have people on crutches, that kind of thing. They do they will have somebody like running by, excuse me, kind of thing. Like, so they have that excitement to make sure the dog's not going to get all wound up, because the people are, like, in the hospital. I'm sure you've been there, where like things happen and sometimes there's a code and nurses are running down the hall. You don't want the dog chasing them and tripping them and that kind of thing. Could be person on a bicycle, rollerblade, skateboard, whatever the case may be. So they want to know that the dog's not going to react to those unusual situations or sudden noises and that kind of thing. The leave it. Oh, so here's what we were talking about. The leave it. You were talking about the treats. So part of it is leave it. Don't touch it. If some person, patient, whomever, somebody offers your dog a treat, they should not take it. It should be a leave it situation. So they're not going to take it from the instructor, the examiner, the patient, whomever. If they see something on the floor, that's the second part of it. So you'll walk your dog on your heel and there'll be some kind of piece of food or something in its path. You have to make sure the dog leaves it, because in a hospital setting, right, it could be a pill, it could be anything. You don't know what they're eating. So they definitely have to leave it really well, which is tricky for dogs, but they learn it. They do learn it. They're meeting another dog, they'll have a demo dog who's already been exposed to all this, and they'll walk past your dog just to make sure your dog doesn't react to another dog. And the second to last test is entering the door through the facility. So you're going to sit and let somebody go through first. You put your dog in a stand or down, whatever works for the dog, going through the dog. The last test is the hardest one, I think, the reaction to children. So they're going to have children running and yelling and playing and doing what kids do. And you have to walk past the kids like a distance of 20 feet, they say, and you have to lie your dog down beside beside your handler. You're going to simulate reading a book, but the dog has to have his back to the children and ignore the children, which is hard for dogs. It's hard for people. So that's the last of the 13 tests. So Alliance of Therapy Dogs, that's the other big organization that we were talking about. So they have a different way of doing it. They just sort of observe you. They go to a hospital setting 3 times. They come with you, 2 visits to a medical facility, 1 somewhere else, like maybe a school or whatever. And they watch you and they say okay, well, you need to work on this or that. And then they do it again, work on this or that. And when they feel like you've got that down, then they recommend you to TDI. But TDI won't accept you if you're already a member of Alliance of Therapy Dogs. So there's that kind of loophole. So I think people see oh, this is an easier way out. It's faster. But if you belong to Alliance of Therapy Dogs, then Therapy Dog International won't accept you. So just a heads up there. The reading to dogs, we were talking about that earlier. Huge amounts of research that show improved reading skills, increased motivation and confidence, enhanced focus and concentration. It can foster a love of reading, because now the kids associating that with this nice, comfy, cuddly dog that's sitting next to them while they're reading. So it's all good things going on there. Somewhere there was some downside to it, and I don't remember offhand what it was, but it was pretty insignificant. But most 99.9% of the research is showing that it is improving reading skills in children, because dogs don't care. If you mispronounce a word, the dog doesn't care. You're just going to fix it and move on, So just that fluency and accuracy and comprehension gets improved just by the practice. And the kids don't have to be embarrassed or feel criticized or anything like that. So there it is. The dislikes. So the downside was, if the child reads to a dog and the child dislikes or is afraid of the dog or is distracted by the dog, then it's not going to improve their reading skills, right? Because they're not really reading now, they're playing with the dog. That would be me. I would be the kid that plays with the dog and not actually reads to it. So I would need to work on that personally. But the other part of that is they do feel supported. They feel connected. They feel mood elevation, because everybody gets happier when they see a dog. They just do. I know they do. And all of that. So there's that whole flow chart, which you can also add into your proposal when you bring it to your school and be look, all these good things are happening. Let's see. So the research is showing it takes about 18 months is your average time to train the dog. There are approximately 200,000 dogs registered as therapy dogs in the United States, which is amazing. And 60% of hospice workers actually include therapy dogs in their therapies with with the hospice patients. And so that again goes back to the comfort care, the alleviating the pain, the distraction, you know, the cuddles and all of that stuff. So they're finding more uses really for therapy dogs, in fact, every day. So they do offer a wide range of physical, mental, emotional benefits. They bring joy and healing. They do. And let's appreciate these amazing creatures. See, I'm totally a dog person. Can you tell? That's my Xena on the screen when her orange in training vest. She's a little bigger now. She's still a tiny little girl, but she's getting there. And we're gonna make it. We're gonna make it happen. I'm hoping to make it happen. Barriers to getting therapy dogs in your school, the lawyers. That's a huge piece of it that I've seen, the lawyers. So if we can show them like, here's all the research, this is all the good things. And by the way, I've got insurance, so there's really no reason for you to decline it. That's the path I've been taking. So what can we do to help you guys get where you want to be?
I have a quick question.
Sure.
Do you only get one chance in the test?
I
Or
think
if you, for some reason, something goes wrong, do you get another chance?
I would say you would have to probably reschedule it and try it like probably months later. Bree shaking your head, right? Has that been your experience too? That, yeah.
Yeah, if you they like on sit stays and things like that, they will let you redo that or, you know, try again. But there's instant fails where you are just told like you can't, you're done basically. Like if the dog is reactive to another dog, takes a treat from someone, those kind of things are instant fails where you don't get to attempt again.
But can you, like in the future, 6 months later?
Yes.
kind of thing?
Yeah, I mean, you
then
could
you
do
can.
it the next day if there was a test being offered.
Mhm.
You absolutely could do it like the next day. Like my dog didn't pass the first time, so I found a different testing site and a different test evaluator,
Mhm.
and she passed without any problem.
Right.
Good to know. Thank you.
That is good to know. Thank you for sharing. Any other questions or Bree, anything else to offer? Because you've been through this now. Your dog is certified, so that's exciting.
Yes, very exciting. I just need to get her at my school. I
School.
need that. That's the piece I need.
Right.
What barriers are you facing?
I think the barrier is, for lack of a better word, I'd say administrative support.
Mhm.
I've been waiting for the superintendent to do it, and I've been working on it for about a year now, because my dog has been certified for a year. And I just need to, I guess, be more proactive myself and not wait for them to do it because it's not happening.
So have you like presented to the board? Like, has it gotten that far or it hasn't even gotten that far?
It's gotten that far, but I wasn't at the presentation. I sent it to the superintendent, and they said that the school needed a policy and the board needed to do that, and it's stalled.
And that's where it stalled.
Mhm.
I can when I get back to school, I might be able to do it actually from home tomorrow or later tonight. I will download a copy of our school policy and
That would
send
be
it to you. And this way you can be like, hey, look, this does exist somewhere. Let's just
That would be
that
wonderful.
kind of thing. Yeah,
We're-
absolutely.
My school is getting a new superintendent starting July 1st, so I'm very hopeful that
Oh,
things will get done and be done. So
Mhm.
crossed.
Gilboa?
Yeah.
Do you know who the superintendent is?
Is it Bonnie? Is Bonnie going?
Yeah.
there? Bonnie
yeah.
Bonnie is
Johnson.
going there.
Yeah.
Awesome. Perfect. Everybody that had her at
Wondered what
Franklin,
was
they
going on with
loved
Bonnie.
her. They loved her in Franklin. So good for you for having her. And I feel like she would be somebody you could convince to do that
Mhm.
easily. Excellent.
Yeah, I'm really hoping.
Aaron's thinking. You see,
Well,
he's
she was
like,
on our board, so I was trying to
Yeah.
figure out like, but that's ONC, so she can't
Right.
be on the board from there.
Right. Okay. Awesome. So yes, I will definitely send the proposal that I sent to our board, although you've been to the board, but I'll send that as well. The proposal, the opt-out
Yes,
form,
please.
the introduction, all of that. And this way you can just like make a copy and then just tailor it to your own schools. Super.
So Jordan, where are you in this process?
I have an older lab golden mix. She's 6, but when she was younger, she just did not fit the criteria. She's got a lot of energy. She's a love bug, but just not what I needed. And then my 14-week-old golden is showing perfect signs to be on the right track for this. He loves everybody so far he's met. We haven't
Awesome.
gone out too much. He's finishing his last round of shots, so
Yep,
we've
yep.
been home right now, but he's got good focus right now for me. And he's a love bug. He is one of those, you go to touch him and he flops right on his back, like touch me anywhere, I love you. So I'm really hopeful. My school is supportive having dogs in the building, but I would definitely have to start the process of communicating with the board. But I have quite a timeline. He's still so young, and with the year at minimum, I've got a good amount of time to work with him. So
Right, right. So he'll be perfect by the time his year's up. He's gonna
I'm
be all
hoping he
perfect.
stays on this. I don't know. We're going to be reaching the teenage crazy stage soon, so we'll see. We'll see how he comes about. But I'm feeling pretty hopeful that I'd love to have
That
a
was great.
certified dog in our building. We've had dogs, puppies in the ag room, and some things like that. But I'd like to have some consistency.
Right. Nice.
So Danielle, how about you? Where are you in this process?
I am actually just finishing up the star puppy training with my dog and everything, and I'm just kind of focusing on the basic obedience stuff. I mean, temperament wise, he's absolutely fabulous. Everyone's like, this is a puppy. So I'm just waiting for that puppy energy to come. But my other concern is he is a Great Dane, so he's going to be a big boy.
Oh,
But he is very well behaved. So I don't know if that will throw any factors into that.
And do you think your school will be supportive of that?
I think so. Yeah. I mean, so I'm at Franklin, so Bonnie's leaving us.
wait, oh yeah,
Yeah, but
Sorry.
no, it's okay. Teresa, our principal at the moment, she's been talking about therapy dogs all year and things like that. Not that she's going to be the superintendent. So whoever comes in, I'm hoping that they'd be willing to for that and all. But yeah, I don't know.
You have a good ally in Teresa, I think.
Yeah.
That's awesome. And Franklin's just tiny enough where you could get that by, like there's everybody would know the dog, that you know what I mean? Like I think that would work
Yeah.
there really well. That's
Yeah.
awesome. Very cool.
Um,
And Great Danes are amazing.
yeah, no, he's fabulous.
Yeah.
Absolutely fabulous. And so I've got him here with me now. We're about to get the final testing for the star.
Oh, good luck.
There's the
Awesome.
How about Leslie? Where are you in this process, Leslie? Is she able to talk? I don't know if she's able to talk.
I don't know. You're muted though, if you are talking.
I think that's why she's been chatting and.
Oh, okay.
Oh,
All right.
I'm here.
Oh, there you are.
Sorry. Yeah, our puppy, she just turned a year old, so we're in the process of getting her tested. So, but our school is definitely behind having her because we had a therapy dog before and she has since passed away. So we want to get a new one. So they're definitely for it.
Awesome. And what school is that?
Beamer's Guilford.
Okay. Okay. Awesome. So what is it? So you said you've had the dog in the school before. How does that pan out? Like, what does that look like in a day? Does it stay in one classroom? Does it travel between the classes? Like, how does it work?
Yeah, no, it was one of the teachers I work with. She had it in her classroom. So she wouldn't come every day. She'd like maybe come a couple days a week. And she just had like a bed in there for her to lay on. And the kids would come and, talk to her, and they were having a bad day or whatever. They would come read with her, or just hug her or whatever they needed to do.
Right.
Does anybody know if there's schools that already have this going on around us?
Colpaskill told me they had a couple dogs there. The actual like middle school said they had a few there in the past. But they don't presently, and I'm not sure why, but they said they were still interested in getting a dog back into the school, that they found it was helpful to have it.
I wonder how we can support this as a teacher center. One of the things that teacher centers do is we have networks that are connected by either subject area or topic area or something. I wonder if there'd be enough interest in having a network centered around this. What do you guys think?
Mhm.
I feel like the teachers and the staff would, but it's the administrators that are being the problems.
Well, I guess that's what I'm kind of wondering about is if we could get people like Bree's pretty much on the way. We had Leslie with the districts already there. So like what issues, what problems come up? How do you engage, solve problems related to it? Is there certain tricks, strategies, things that you can do to help support the reading initiatives and the therapy initiatives and things like that? I
Right.
wonder if a group would help bring people together. I don't know.
Right,
That's what I'm thinking about.
right.
I don't know what your guys' thoughts on such a thing. Is that something that you think is valuable, or is it not really? Is it something that we come together and meet, or you did mention there were several Facebook groups and
There are, yes, actually there are, and that's where I got a lot of my, the proposals and the data and the research. There's a woman, she was working actually on her doctorate about therapy dogs. So she reached out and was like, oh my God, I have so much information. Like, how can I help you? So the help for us for what we want is out there. It's the administration that we need to, I get it. They're all like, what if the dog bites somebody? Well, what if you have a concussion on a football game? Well, they sign waivers. Okay, so we'll have people sign waivers. Like, how is that different? But they seem to be really kind of digging their heels in on this like legal issue of it. Where again, I was like, I don't understand what your problem is, because we literally carry insurance on these dogs. So it's not costing the school anything. But this is the excuse, at least that I got at my school. Where like the middle school, that principal was completely on board and he was like all set to like just bring the dog in, kind of thing. So I think it depends if maybe the one principal just doesn't like dogs, because even when I brought her to meet him, most people are like, oh my God, she's so cute. They hug her and they kiss her. He was like, oh yeah, pat, pat. Oh yeah, nice dog. So I was like, oh, okay. I see where this is going. He's just not a dog person, but they shouldn't let their own emotional
That's right.
things, in impact what happens in their schools. But this particular guy does anyway, but.
And I forgot, after I had already talked to you about doing this, somebody else reached out to me and said that there is a professor on campus that is very knowledgeable about therapy
Oh,
dogs.
It's good to know.
So we could reach out to that person too, if that's,
Right.
an ally, something that we need.
Right.
So I think what I would like to know is what can we do to support you guys, and is there things that we can do? What can we do to help and all that kind of stuff? Because I love my job. My job is totally to support you guys. Like people don't realize that. They're like, what do you do? And like my job is really here to be like, yeah, why don't we have this? Like, let's call Aaron and find out if we can do this.
Yeah, I don't know. I mean, I'm grateful to have this, even just this little group we have right here, because I've already learned so much just from each other. So I do think that's super helpful. So thank you for being here, and thank you, Aaron, for not forcing me. He asked me, he's like, could you do this? I'm like, I'm not an expert. I'm just learning. He's like, that's okay. That's what we do.
That's what we want. We want teachers to teach other teachers.
Yes, for sure.
I need to educate our administrators on therapy dogs and the benefits.
Right. See, I handed
Sure.
mine that. I literally handed him a packet with, here's the information, here's the research, here's all the data that backs it up. And he was still like, the lawyer said, no, it's not a dog, it's a puppy. But it could go to our ag room as a puppy, and that was okay. I'm like, even our ag teacher, our prior ag teacher was like, that doesn't even make sense. She's like, I had dogs in the school. She had them in there before. But this particular new principal is just, I don't know, he's got issues. He'll learn. I hope he'll learn, but.
What
he's-
about like sending information or presenting it? Do they do Principals Academy or I don't know, do superintendents have an academy like that?
They do, they have a superintendent's cabinet.
So like maybe talking or getting on the agenda for that.
It's a good idea. So you hit all of them at once and be like, hey, this is a thing. This is happening. Like, be on board, be on the cutting edge, right? Play to their egos. Be that one that steps up and takes that chance. That might
It's
work.
hard to get on
their agenda.
docket, Yeah,
Yeah.
yeah.
Mm.
I wonder if we, yeah, I mean, we
Do
could
you want the
try to
mouse?
reach out.
I'll give you the mouse so you can do it.
Yeah,
Yes.
so we'll
Yep.
share this PowerPoint, right?
Yeah, well, I'll absolutely share the slide deck and then all the stuff I do have that I shared with my administrators, the proposal, the opt-out form, the introduction form to the parents, like I will share that to everybody.
Actually, send that to me.
and then
so
you can
I
push it out.
Send it out.
Okay.
'Cause, I'm paying you for this one, right?
You are.
So technically, I think I own this.
Oh,
But,
perfect,
yeah.
even better, yes.
Yeah, and so like, that's the other part of it is like, we pay people when we have a budget, we will pay teachers to teach a passion project or something that they want, so. Yeah. So then we'll make a shared folder, we'll put it on a shared folder. For them.
Absolutely. Yep, just make a copy, tailor it to your school and your needs, and bam, done.
Thank
Insert-
you so much. I have to hop off though.
Yeah, I'm glad
Yeah.
you could make it, that was great. And please contact me, like, I just don't get, my services don't get used enough, so contact me if you want to teach something, if you want something to happen. Yeah,
All right. Well, thank you very much. Have a good night.
Thank you, you too.
you too. All right,
Right.
so did Tammy end up coming? We're
No.
missing Tammy and a Catherine, I think, right?
Right.
Did Catherine end up coming?
No,
All right.
all right.
There is an evaluation form there. If you could take a moment to fill that out, I'd appreciate it. If not, don't sweat it. You can use the QR code there, or let's see if I can throw it in the chat. There needs to be a way that you can do that easily. And link,
Let me see if I can.
copy. And where did my chat bar go? Beautiful. Obviously, I stepped out there for a moment, but it sounded awesome to me, MJ.
Oh, thank you. Are we good? Are we muted? Are we set? Any other questions? We're good?
Oh, so
All
yeah,
right.
yeah, so we're gonna end the meeting and thanks, everyone.
Thank you all. Let me let's see if I can find this stuff, my proposals real fast.
Did you guys get the link? You're all good? All right, so we're gonna end the meeting and we'll send you all that information later. Good?
Yep, thank you so much.
Thank you.
Thank you.
Thank you.